Buy Bitcoin.
Not say that.
I could have bought Bitcoin at 25 cents. Up. I up.
Okay.
Dentistry sucks compared to being rich, but Hi, my name is Dr. Akash Barot. I'm a dentist at Buckhead Smiles Center, and you are tuned in to Next Level Learning. So what initially got me into dentistry is my father's a dentist, and being Indian, I have a lot of family and relatives in the medical field, so I always had a penchant for medicine and science. But what called to me with dentistry was you could mix business with medicine, so I thought it was the best of both worlds. And it's been really challenging, especially when I first starting my own office, learning the rigors of management, billing, but also doing dentistry, and it's a very fulfilling field. But that's the main reason I went into dentistry and medicine. So the reason why I chose dentistry is because I knew I wanted to be in medicine. However, the ability to change someone's smile, give them confidence, improve their chances at a job, love life, or just feeling better about themselves really was appealing to me. I had actually an experience when I was younger. My father took me to an aesthetic dentist, and he fixed up a few of the spaces between my teeth that I was really insecure about, and it just was life-changing. And just being able to do that on a day-to-day basis, it's very fulfilling. It's a lot of fun. So one of the struggles I had when I first started with my practice was setting up the infrastructure and getting a bunch of staff to agree with my vision. It's easy to explain to the patients and communicate with them, but getting the staff to buy into our process and why we're doing everything, that was the biggest challenge. And managing a staff of a bunch of young, very smart, intelligent women was troublesome. They were very mean. They made fun of me a lot, but I found it really rewarding, and it was cool to see them grow and pursue their careers as well. Well, what was really interesting when I first started was my first practice was in Northeast Philadelphia, a low-income area. I call it the hood, but honestly, that was the best area for me to grow because it was a population that needed to be served, and I'm a minority, so I have a lot of pride in taking care of minorities, and Black and Hispanic communities are extremely underserved, especially in Northeast Philadelphia. So I was from the suburbs of Philadelphia, but when I first got to Philly, I kind of fell in love with, the need, and that's also a reason why I was able to differentiate myself. When I first started, there was not a lot of young dentists. What I see with the underserved communities is they were not getting access to a lot of care. So not only was I serving the community that needed the most, it was actually a way for me to differentiate myself. There was a lot of patients that were not getting the best care. I came in there and was able to give them nice ethical treatment. It built my brand, and from that, so actually what's really interesting, when I first started in 2014, I came out guns a-blazing, decided to throw a bunch of money into my new infrastructure, and I ended up spending money before I started making money, and I almost went bankrupt. So in 2015, I still remember my first couple weeks of January, I had to make payroll, and I remember telling the girl I was dating at the time, I said, Lauren, I don't think, I'm gonna barely skate by, and then she offered me a loan. And I don't know what burned inside me with this girlfriend offering me a loan, but I was like, I'm doing something wrong. So I buckled down and I broke up with that girl. No, I'm just kidding. I dated her. But at that moment in 2015, I had a lot of extra overhead, so I cut down my staff. I went back from working 9 to 5 to working 9 to 9, 7 days a week. And that first year, I was able to build a practice so much so that by the second year, I opened up a second office. I was able to purchase a second. And then, because I'd done it before, I was able to build that office up into the third year by my third. So that's what really kind of jettisoned me on the right path. Struggling, almost going bankrupt, and kind of having to do everything on my own. And then when I first started, it was a little practice in the hood in Northeast Philly. I painted, I cleaned the toilets. I couldn't afford Roto-Rooter when I first started, so I had to take the snake and learn to do it myself. So that's my biggest lesson. If you really want to make money in this world, you just got to put the time in. You can be the smartest person in the room, but if you don't work hard, nothing comes of it. So really, the key is if you are naturally smart and you're gifted and you do really well in school, the only way you're going to make use of it is actually putting the time, doing the work. And it worked out for me. When we talk about the differentiation between general dentistry and cosmetics, I say they're both the same. honestly, all general dentistry is cosmetics. So I don't care if the patient is paying cash or they have Medicaid insurance. You know, when I finish your tooth, it should look like I've never touched it. It should look very natural. So everything I do is cosmetics. I don't care if I'm doing dentures, they better be the most lifelike dentures you've ever seen. So to me, dentistry is all cosmetics, and that comes included with the fee. Like, you need to be proud of it. So while other dentists differentiate, I think I've been a dentist that a lot of patients can come to from all ages and all walks of life, and that's what I find fulfilling. So is it the most fulfilling to do veneers on soccer moms who probably don't need it? No, it's not the most fulfilling, but it is satisfying to make them happy. But yeah, I think, you know, even though dentures don't pay the most, you know, doing something like that and restoring the dentition and function of an old grandma or grandpa is a lot more fulfilling. So you kind of have to do both to pay the bills, but I really think all dentistry should be cosmetic in my mind. So that's the way I approach it. And I will say one thing I will say about dentistry is, you know, there's a bad rep that dentistry has to be expensive. But really, sometimes patients think they need a full set of veneers, but it could be something more economical, like aesthetic bonding. And I like working with people, especially younger patients who need a leg up on interviews, or, you know, fresh out of school, they can't afford big braces or veneers. Come in, maybe we need a couple veneers and more aesthetic bonding. As long as everything looks perfect, I think the patient's happier. So budgets you can definitely work with. You know, it doesn't have to be $50,000. You know, you can make anything work within a budget. I say when it comes to dentistry, if you go around, you know, my best advice is get consults from different dentists to address your aesthetic needs. If you get something that has a high price tag and you have some sticker shock, don't be disheartened. Go see another practitioner. Come see me in Buckhead Smiles Center. I'll do a free consult for anyone attending the event, obviously. But yes, the best thing you could do is just get a workup. I think any dentist will be comfortable giving you a free consult. And like I think the most exciting thing about dentistry is now you can be a lot more creative than previous dentists used to be. See, back in the day, there was general dentists, and then they had specialists who did endodontics, which is root canals, ones for prosthodontics, which is like big aesthetic cases. But now the technology has improved so much, plus the educational standard has skyrocketed, so dentistry is very competitive to get to. So if you're looking to get into the field, first advice is study hard, get those good grades. And then once you're there, you're gonna see there's laser dentistry now that they offer in dental schools. So the innovation is even surpassed where I left off, and I graduated in 2014. So it's changed so much. So that's exciting. And you can do really cool, like full mouth rehabs on, you know, just average patients walking through the door. So you don't have to be, you know, doing huge veneer cases to do beautiful aesthetic dentistry and make people happy. I do it all day, and it's really fulfilling. I told myself that dentists get to date beautiful women. So that's what I told myself. And that's how I made it through dental school. Now, it hasn't worked out. So it's not that easy, but that was a lie I told myself going through it. What really kept me focused was I just enjoyed it. You know, you kind of have to really like it. Dentistry, and in any profession, like, people think you'll just become a dentist and you'll make good money, but it'll get boring really quickly. So, you know, after 5 years, I also, in my career, I hit a little bit of impasse, because I was like, I kind of got burnt out from, I hit my clinical limit, but, you know, business-wise, I was just, you know, working 24/7. And one of the reasons why I sold my practice was in order to work in Buckhead Smiles Center, which is a really high-end office in Buckhead, Atlanta, it would have taken me like 20 years to save up millions of dollars to buy an office like that. So joining up with a group like that has allowed me access to better technology and serve a different patient base. So I've really enjoyed that. So if anyone's struggling with dental school, but you really like it, you know, stick with it. And then if you're in dentistry and you're struggling, because it is tough. You know, I'm successful and I struggled a lot and I wanted to leave almost. I say try something new. So if you don't like certain procedures, and this can apply to any industry you're in, maybe try considering moving to a different department or going back to school for a specialty, because I don't have parents to pay for my education, so most of us, when we take out money, we have to pay those bills off. So if you do feel like you're getting burned out in any field, maybe try taking a little step back and either applying for a different position in the same field, or trying to reorganize how you approach something, because you can find a good work-life balance. That's what I needed to do. I didn't actually hate my career. I hated the way I was just working 24/7 and not enjoying the fruits of my labor. So part of being a young ambitious person, especially as minorities, we want to rise up and help people. You got to take care of a little bit of yourself. So make sure you have some time, see your friends, get a girlfriend, boyfriend, be happy. Oh yeah, one more important thing is, when people say follow your passion, that's great advice. You should, but eventually it does become a job. So you need to find passion in completing your job, and also find passion, be able to provide for a family and serve a community, because it's not always like it is on Instagram.